Lindsay Tyndall, and I'm a staff attorney with Triage Health. And today we'll be talking about understanding health insurance. Now, if you have a question during the course of the presentation, I ask that you use the Q&A box on the Zoom screen, and that will direct the question to one of my colleagues who will be able to answer the questions for you there. We are also proud to offer this series in partnership with the Los Angeles Public Library. And before we begin on the substantive material, I want to tell you a little bit more about our organization, Triage Health. Now, Triage Health is a program of Triage Cancer, and Triage Health provides free education on the legal and practical issues to help people navigate through the healthcare system. And this is through resources, materials, and events. This can be especially important when someone is navigating a chronic or serious medical condition. However, many of these issues, like health insurance, impact everyone. So whether you have a serious medical condition or not, this material and these resources can be helpful to you. Now, in terms of what we have for materials and resources, we have a number of different types of resources. So we have written versions, which are our quick guides, our checklists, and our worksheets. We have animated videos and a blog. We also have a website called cancerfinances.org. And while it is directed at cancer specifically, the information contained in that website, which is an interactive toolkit that asks you questions to help you get to certain answers of information that may be helpful to you. While it's cancer specific, the information contained in the website can actually be generalized to anyone, so it can be really helpful for anyone. Now, in the United States, there are only 3 places where people get health insurance coverage. We're either getting it directly from an insurance company, which is going to be a marketplace plan, or we're getting it through the government. And by that, I'm referring to Medicare, Medicaid, various military type plans, or other government plans. But about 50% of people in the United States still get their health insurance coverage through their employer. Now, if health insurance is not something you feel very confident in or that you know well, you are not alone. This is an incredibly complicated subject. For reference, only 4% of people surveyed in this study could accurately define 4 of the most common terms used in a health insurance policy. And only 40% of people felt very confident in choosing the right health insurance plan. So one of my goals for today is that you leave this meeting feeling more confident in your understanding of health insurance and more confident in your ability to select a plan. Now, regardless of where you get your health insurance, so whether you get it through your employer or you get it through the marketplace or you get it through a government-sponsored plan, there are some basic terms that apply across the board. So the first term we're going to talk about is the premium, and that's the cost that you pay each month just to have health insurance. You pay this regardless of how often you're going to the doctor or whether you're even receiving health services at all in that particular month. Next, we have the deductible, and this is the amount of money that you pay out of pocket before your insurance begins to pay for anything. Now, the amount can vary by plan and can be as low as $0, or it could be several $1,000s. Now, next we have a copayment, and this is a fixed dollar amount that you pay when you get certain types of care. So if you go to your doctor's office for an appointment, you may have a $10 copayment, or if you go see a specialist, you may have a $30 copayment. The amounts are going to depend on the coverage that you have. And now that's different from co-insurance or cost share. Now, co-insurance and cost share are 2 terms that are used in the same way and mean the same thing. and they refer to the difference between what an insurance company pays for your medical expenses and what you pay for your medical expenses. So we might have a plan that we call an 80-20 plan, where the insurance company is going to cover 80% of the cost, and we're responsible for that remaining 20% of our medical expenses. And then the last term we have here on this slide is the out-of-pocket maximum. And this is probably the most important thing that anyone should know about their health insurance policy. And that's because in a worst-case scenario, your out-of-pocket maximum is the most that you're going to pay out of pocket for your medical expenses during the year. It's a fixed dollar amount, so you might have an out-of-pocket maximum of $1,000, or it could be $20,000. Again, it's going to depend on your specific plan, how much that amount is. Now, just hearing the terms and the definitions, in my opinion, doesn't make a lot of sense. So to help it make more sense, we have Dan here as an example. Now, Dan has a policy with a $2,000 deductible. It's an 80-20 plan, and he has an $8,000 out-of-pocket maximum. Now, Dan has just spent a week in the hospital, and he walks out of the hospital with a $102,000 hospital bill. Now, assuming that Dan has had no other medical expenses during the year, how much does Dan actually have to pay for his medical bill? So the first thing that he has to pay is his $2,000 deductible, which leaves $100,000 left on that hospital bill. But Dan has an 80-20 coinsurance, so he's only going to be responsible for $20,000 of that bill. But Dan also has an out-of-pocket maximum, and he's already paid $2,000 of his deductible. So Dan only has to pay another $6,000 of that $20,000 bill. Then he'll reach his $8,000 out-of-pocket maximum. His insurance will kick in and pick up the rest of that $20,000 bill. Now, I'm absolutely not suggesting that $8,000 is not a lot of money, because it is, but it is much better than having a $20,000 bill, which is what Dan would have had to pay if there were no out-of-pocket maximum, or even that $102,000 bill that he started out with, which is what Dan would have had if he didn't have health insurance at all. So again, these terms can help you know how much you'll have to pay for your medical expenses, and your out-of-pocket maximum can help you know what is the most you'll have to pay out of pocket in a worst-case scenario. Now, we're going to come back to these terms in a little bit when we talk about how to pick a health insurance plan. I also want to note that this example that we just went through is in one of our animated videos on health insurance basics. So if you want to hear this information again, or you know of others in your life that may benefit from hearing this information, you're able to share that video with others. Now, because the out-of-pocket maximum is so important, I do want to note a few more things. Definitions of out-of-pocket maximums are going to vary by plan. So with a marketplace plan, your deductible is included within your out-of-pocket maximum, like we just saw with Dan's example. But some employer plans do not include your deductible within the out-of-pocket maximum. If your medical and prescription drug coverage are within the same plan, you do want to check to see if you have separate out-of-pocket maximums. Sometimes they calculate your medical and prescription drug coverage together, and sometimes they're calculated separately. If you have a plan for a family, there may be a separate individual out-of-pocket maximum and a family out-of-pocket maximum. Now, there may also be a separate out-of-pocket maximum for in-network services and for out-of-network services. Now, jumping into the places where we can get our health insurance. As I mentioned, one of those places is through the government, and that includes Medicaid, which in California is referred to as Medi-Cal. Now, if you are from another state or you know of others that have the Medicaid program in their state and some of this information doesn't sound the same, that's because Medicaid is very, very state specific. So how it is in California is not how it is across the country. But because we're speaking with the Los Angeles Public Library, we're going to focus on California here today. Now, as of January 1 of this year, access to Medi-Cal primarily depends on your income. So for certain groups, Medi-Cal used to consider your resources or your assets in determining if you are eligible for Medi-Cal. But now California has changed that law, and the state no longer asks about your assets when considering your eligibility. So if you are at or below 138% of the federal poverty level, you may be eligible for Medi-Cal. Now, another option for health insurance in California is the marketplace. Now, we like to think of the marketplace as a virtual shopping mall where the only product someone can shop for is private health insurance plans. This is where you can go to find out what plans are available in your area, and it may tell you if you qualify for Medi-Cal. There are a number of benefits to shopping for coverage through the marketplace, and one of those benefits is that no plan on the marketplace can have an out-of-pocket maximum higher than $9,450 for an individual or $18,900 for a family. And while those numbers are high, they can be even higher if you purchase a plan outside of the marketplace. Plus, it does ensure that there are limits to what you'll have to pay for your care. Now, another significant benefit to the marketplace is that there is some financial help available if you choose to purchase your plan this way. Now, people often assume that a marketplace plan is going to be very expensive, but these plans can be much lower priced than what people expect. Now, depending on your household size and your household income, there are two types of financial assistance that may be available to you. The first is a premium tax credit, and that helps lower the monthly cost of having insurance. And the second are cost-sharing subsidies that lower the out-of-pocket costs for certain plans once you have them. Now, under the American Rescue Plan Act, they added additional financial assistance so that people within 138% and 150% of the federal poverty level could find marketplace plans for $10 or less per month. The American Rescue Plan Act also provided financial assistance at the higher end of the income scale. So if you make more than 400% of the federal poverty level, and your actual cost of insurance is greater than 8.5% of your household income, then you could get financial assistance in order to drop the cost of health insurance down to 8.5%. Now, this assistance was set to expire at the end of 2022, but through the Inflation Reduction Act, it was extended through 2025. Now, states have the option of running their marketplace through the federal government or through the state. California has decided to run their own marketplace, and they call it Covered California. So you can go to coveredca.gov. You enter some basic information about what year you're looking for coverage, your household size, your household income, age, and zip code. And the system will show you which plans you have the option of purchasing and how much financial assistance you may be eligible for. Now, the marketplace is still open for this year. If you are looking into purchasing a plan on the marketplace, you have until January 31st to purchase a plan, and your coverage will begin on February 1st. And now we're going to move over to Medicare. Now, Medicare is another health insurance that is funded by the federal government, and it's available to people who are 65 years and older and who, sorry, or those who have been receiving Social Security disability insurance for 2 full years or more, or someone who has end-stage renal disease or ALS. Now, end-stage renal disease and ALS are 2 medical conditions that automatically qualify you for Medicare. Now, Medicare is broken up into different parts. Part A is hospital insurance, and it's really only going to provide coverage when you're hospitalized, but it does also include some skilled nursing facility care, home health care, and very limited nursing home care, as well as hospice. Now, Part A is typically premium free for people who have paid into the Medicare system over their work history. If you have not paid into the Medicare system over your work history, or you have not paid enough into it, you can still get access to Medicare Part A, but you may have to pay a premium for it. And how much you pay in that monthly premium is going to depend on how many credits you have in your work history. And next we have Part B. So Part B is what most of us think of as medical insurance. It's coverage for things like doctor's visits, outpatient care, lab tests, physical therapy visits, and more. This year, the monthly premium for most people is $174.70. Part B has a premium even if you've worked and paid into the Social Security system. People who Medicare considers to have a high income may have to pay more. Now, the annual deductible for Medicare Part B is $240, and the cost share is 80-20. So Medicare pays 80% of your costs and you pay 20% out of pocket. Now, unlike with a marketplace plan or many employer-sponsored plans, there is no out-of-pocket maximum for Medicare Part B. So if you have a serious health condition, those costs can really add up. Now, when you think back to that example we went over earlier with Dan, you would have been responsible for that full $20,000 bill rather than that $6,000 bill that he had to pay because he had an out-of-pocket maximum. So this is something to keep in mind, especially when we talk in just a moment about Medicare Advantage plans and Medigap plans that can help control some of those costs of Medicare. Now, Medicare Parts A and B together are known as Original Medicare, and that's because that was all that existed when it was initially signed into law. But since then, we have added other parts to Medicare. Now, as I mentioned, Part A is hospital insurance, Part B is medical insurance, and Part D is prescription drug coverage. Now, Part D plans are sold by private insurance companies. So that means the exact costs are going to vary company to company. However, in 2024, the maximum deductible for a Part D plan is $545. Now, each Part D plan is going to have a different list of drugs that they cover and a different pricing structure for those drugs, which is something to be aware of and keep in mind when you're selecting a Part D plan. Now, before 2024, there was no out-of-pocket maximum for Part D covered drugs. But under the Inflation Reduction Act, and starting in 2024, there is now a out-of-pocket maximum for drug costs of $8,000. In 2025, that out-of-pocket maximum is going to drop down to $2,000. And starting in 2025, you will be able to spread your Part D costs throughout the calendar year, rather than having to pay a large payment at the beginning of the year. Now, so far today, we've talked now about Parts A, B, and D. What about Part C? Now, Part C is the Medicare Advantage program, which is an alternative to using Original Medicare. Medicare Advantage plans are sold by private insurance companies and they're managed care plans. So they bundle all the services that someone would get under Parts A and B, and some of them also include Part D. And they operate similarly to how an employer-sponsored plan or a marketplace plan may work. Medicare Advantage plans may also include extra benefits and services in addition to what's covered under Original Medicare. So a Medicare Advantage plan may also have coverage for routine dental and vision care. In terms of the costs, a Medicare Advantage plan is going to depend on the specific plan that you buy. So the premium, the deductible, and the cost share are all going to vary. But by law, the most that a plan can impose for an out-of-pocket maximum for in-network services in 2024 is $8,850. But some plans may also have a lower out-of-pocket maximum. I do want to note here that the out-of-pocket maximum does not include costs for prescription drugs. It only includes costs that would otherwise be covered under Parts A and B. Also, even if your Medicare Advantage plan has a premium, you still must pay a Part B premium as well. Now, you may be thinking, what is the benefit of paying more money for my Medicare? One of the biggest advantages to a Medicare Advantage plan is that there is that out-of-pocket maximum. So with Part B, there is no out-of-pocket maximum. But if you have a Medicare Advantage plan instead, you may have that out-of-pocket maximum. One of the cons and something to consider is that Medicare Advantage plans may have a small number of in-network providers, which means that if you go out of network, whatever you pay won't be applied to your out-of-pocket maximum. However, as I mentioned, Medicare Advantage plans do also have additional benefits to them, and they may be little or no added monthly cost. You would still have to pay what you would for Part B, but by picking a Medicare Advantage plan, you may get extras like possible drug coverage, hearing and dental coverage, and sometimes even things like a gym membership. But again, on that con side, these plans are typically going to be specific to a state. So there isn't going to be that same national coverage that you might get with Original Medicare. Now, another option is a Medigap plan. So if someone has Original Medicare, again, that's Parts A and B, there are out-of-pocket costs associated with those parts and no out-of-pocket maximum. So one way that someone can protect themselves from those high costs is through purchasing an additional insurance plan called a Medigap plan, or sometimes referred to as a supplemental plan. Now, what these Medigap plans do is they pick up the out-of-pocket costs that you would have had to pay for Parts A and B. So, for example, a provider would bill for a Medicare service, the patient would pay the deductible, and then Medicare will cover 80%. And if you have a high enough Medigap plan, that Medigap plan will pick up that remaining 20%. So these Medigap plans are sold by private insurance companies, and they're a separate thing that someone would have to purchase in addition to Original Medicare. Now, we're often asked which is the best way to go, and the answers there is it depends. But you do want to note that when it comes to selecting your options, when you select your first choice, you have that plan until that next open enrollment period begins. So if you start, for example, with a Medicare Advantage plan, and then you decide in that next open enrollment cycle that you would like to move to Original Medicare, one thing to keep in mind is that if you don't choose a Medigap plan when you are first eligible, those plans can deny you based on having a pre-existing condition in the future. So if you have a history of a serious medical condition and you think you may need extra medical services, it may be in your best interest to select Original Medicare with a Medigap policy early on. Now, to help visualize what that may look like when looking at your Medicare options, there are two lanes that you can drive in. The first is Original Medicare, which again is that Part A hospital insurance and Part B medical insurance. And then you would have to decide if you wanted prescription drug coverage as well, in which case you would pick up a Part D plan. And then you would decide if you wanted to protect yourself against those potentially high out-of-pocket costs, in which case you would purchase a Medigap plan. Now that is lane one. Now in lane two, you would start with a Medicare Advantage plan, otherwise known as Part C. And under this plan, your Parts A and B services are bundled together in a managed care plan. And if that managed care plan that you select does not have prescription drug coverage included, then you may decide to pick up a Part D plan as well. Now, these are the two options that you have with Medicare. You're not able to have a Medicare Advantage plan as well as a Medigap. You have to pick one or the other. Now, if you are struggling to pay for your Parts A and B costs, there are some programs that may be able to help. Collectively, these programs are called Medicare Savings Programs. And there's actually 4 different programs with different requirements and benefits. But we have an entire quick guide on Medicare Savings Program available on our website. Now, if someone is struggling with the out-of-pocket costs under Part D prescription drugs, there's something called the low-income subsidy or extra help. And this program can help pay the premiums, deductibles, and co-payments for prescription drugs. And some states also have something called a state pharmaceutical assistance program. I do want to note here that sometimes it is specific to certain medical conditions that would have that program apply to them. Now, for those who are looking for resources to help you compare Medicare plan options, the Medicare.gov website has a plan finder tool that allows you to search by zip code to locate the Part D plans and Medicare Advantage plans that are available in your area. It can also provide some details regarding the costs and the drugs that may be covered under those plans. We also have a Medicare options comparison worksheet that can help you go through the process of comparing to Medicare plans. Now, if you are in need of additional help and guidance, their good news is that there are places that you can go to for help. Now, we just went through that Medicare Finder tool, but there are also state health insurance assistance programs in each state, and Medicare has a toll-free hotline where you can speak with an agent. The Centers for Medicare and Medicaid Services also release a guidebook every year that you can get for free online, or you can request a hard copy. Now, when someone is actually able to enroll in coverage is going to depend on the type of coverage that they have. So when it comes to Medi-Cal, applications are accepted year-round. So as soon as somebody becomes eligible, they can apply and their coverage will typically begin. For the Marketplace, there is an annual open enrollment period that usually begins in the fall, where you're purchasing your insurance for that coming year. You can still purchase a Marketplace plan on coveredca.gov until January 31st, and your coverage would begin on February 1st. Medicare also has an annual open enrollment period in the fall, and employer plans are going to vary on when their open enrollment period is because employers can select their own dates. However, they do typically happen in the fall to coincide with that January 1 start date for insurance. Now, when it comes to comparing a plan, we are going to go through a little exercise about how we would go through the process of looking at the costs for several different plans and comparing them to each other. Now, this exercise is going to be using marketplace plans, but I want to note here that it can be useful in comparing, for example, to employer plans or to Medicare plans. It doesn't necessarily have to be marketplace plans. So here we have a hypothetical person with 3 plans available to them. We have a bronze plan with a $200 per monthly premium and an $8,000 out-of-pocket maximum. Next, we have a silver plan, the silver plan with a $275 monthly premium and a $6,000 out-of-pocket maximum. And then lastly, we have the platinum plan, which has a $400 monthly premium and a $2,000 out-of-pocket maximum. Now, assuming that you're going to hit your out-of-pocket maximum during the year, because when we are talking about the cost of medical care, particularly for someone who has a serious medical condition, the likelihood of you hitting your out-of-pocket maximum is quite high. So the question here is, are you able to just look at this slide as it is and see which plan is going to cost you the least at the end of the year and how much they're all actually going to cost you in their entirety? Now, the answer there is no. You do have to actually do the math when you're comparing the plans. And the way that you do that math is you take the monthly premium and you multiply it by 12, because that's how much you'll pay during the year just to have the insurance coverage. And then you take that amount and you add it to the out-of-pocket maximum, because that's the most that you're going to pay out of pocket for your medical expenses during the year. So in this example here, we see that the platinum plan ends up saving you over $3,000 compared to that bronze plan. Now, this is why it can be important to understand the different terms when looking at a health insurance policy. So with that bronze plan, we see that low monthly premium and may think that that is going to be the cheapest. Whereas that platinum plan, you might get a little sticker shock of how expensive it seems. But when we consider that out-of-pocket maximum and we take into consideration how that's going to affect the overall cost, it can change how we look at our different health insurance options. So doing the math is incredibly important. But I do want to note that when you're picking a health insurance policy, it's not just about cost. Cost is important, but there are other things that we want to be paying attention to. First, you want to make sure that the plan you're selecting actually covers your providers. So you want to make sure that your providers and the facilities, hospitals that you use are within the network for that particular plan. Also, you want to look at what that prescription drug coverage looks like and to see if any prescription medications that you take are actually covered by that plan before you select it. So this goes back in under how important it can be to understand the various terms associated with your health insurance policy. Now, because picking a health insurance plan can be so important to our overall finances, but can also be very complicated, we have a number of resources on our website about picking health insurance plans. We have animated videos as well as worksheets and quick guides that can all help you with this process. Now, once you've selected a health insurance plan, it does not stop there. The next step is effectively using that plan. Now, one way to make sure that you're effectively using your health insurance is to not take no for an answer when you disagree with the decision that your plan makes. Now, appeals are complicated and we only have a limited time together, so I'll do my best to summarize. But generally speaking, people have 2 opportunities to appeal an adverse benefit determination or a decision that didn't go their way. The first is called an internal appeal, And this is essentially where you're going back to that health insurance company that said no and asking them to reconsider covering your claim. The second opportunity is an external appeal. And this is where you go to an independent entity and ask them to look at the situation and decide whether or not the insurance company should have covered the claim. The exact timing and details related to the internal and external appeal process are going to vary based on how someone's getting their health insurance coverage. So it's important to understand how you're getting it. So whether it's through an employer, whether it's through the government, or whether it's through the marketplace. It's also helpful to have a copy of your plan in writing so that you're able to see those rules yourself to help you go through that process. Now, what many people do not realize is that about 50% of appeals are successful. So 50% of the time, the insurance company is getting the answer wrong. But consumers are rarely appealing their denied claims. So in this graph, you can see here, less than 1% of all denied claims in this study actually got appealed. So when we talk about access to care and reducing that financial burden of medical care, this is a hugely underutilized tool that we have available to us. Now, because of that, we have a number of resources that can help you with your appeals process. This includes an animated video, which can be a really great way to explain the appeals process to someone who might be unfamiliar. But for more information on how appeals work for your specific type of health insurance, I would really recommend looking at the health insurance appeals module on our Cancer Finances page. While it has cancer in the name, the information you can find there is not cancer specific, and it can help you understand the steps that you may have to take in order to appeal a denied claim with your type of insurance. And now the reality is that even if we have adequate health insurance and we're appealing all of our denied claims, that isn't going to completely eliminate your medical bills. So people are often left feeling like this guy chatting with his friend saying, my doctor told me to avoid any unnecessary stress, so I didn't open his bill. While he's taking an interesting coping strategy, and not one that we would necessarily recommend, there are some things that you can do to reduce the burden of medical bills. Once you've received care, you typically get a ton of correspondence. Just from your insurance company, you may get 3 different pieces of mail, one saying that they've received your claim, one saying that they're processing your claim, and then one called your explanation of benefits, or an EOB. You can tell that something is an explanation of benefits, typically because it will say in large letters somewhere, this is not a bill. But it will give you an idea of how much you may have to pay out of pocket for that particular healthcare service. Now, explanations of benefits can be a bit challenging to decipher. So we're going to look at an illustration of one together. Now, every insurance company presents this information in a slightly different way, but generally speaking, they all will have this level of information. Now, as I mentioned, the first telltale sign that something is an explanation of benefits is that somewhere on the page will appear the words, "This is not a bill." You should also be able to see some information about the policyholder and who the claim is for. There will typically be some sort of summary of the claim, including the date of service, the amount being billed, the amount that's being covered, and what you're likely responsible for paying. Lastly, your explanation of benefits should somewhere indicate how much you have already paid towards your deductible for that year, how much you've paid that's been applied to your out-of-pocket maximum, both your individual out-of-pocket maximum, and if you have a family plan, your family out-of-pocket maximum as well. Now, as we mentioned before, understanding and keeping an eye on your out-of-pocket maximum can be really helpful to planning your medical care going forward. And then lastly, the piece of information that you'll receive will be that bill from the provider. Now, in this explanation, I laid this out as very consecutive, very clear process, but unfortunately, in the real world, it does not always work like that. And one of the challenges could be that sometimes you receive this information in different forms. So you may receive some of this through your actual postal mail, or it may come through an email, and they may not all come in the same order. Many providers are much faster at sending the bill than the insurance company is at processing the claim and sending you that explanation of benefits. But if someone pays the bill before they look at their explanation of benefits, they may end up paying more to the provider than what the provider is actually owed. And then you're in a situation where you have to ask for that money back from your provider, which is just one more additional step that I'm quite sure none of us want to deal with. So waiting until you get that explanation of benefits before you pay your bill is typically a good course of action, but you want to be communicating with your providers what is happening. So you don't want to wait and have a due date come and go and never communicate with your provider, because then they may think that you're just not paying the bill. Typically, what I would do in this situation is I would call up the provider and say, hey, I haven't gotten my explanation of benefits yet. Can you push back the due date or make a note in my file? And to date, I have not heard any problems with this strategy. So we really recommend waiting until you can have both that bill from the provider and your explanation of benefits in hand to check them and compare before you are paying that bill. Now, if you are in a situation where you owe your providers money, try talking with them. We suggest doing this before they turn your bills over to collections agencies, which can help protect your credit rating. But if you can't make a payment, ask for more time. Check to see if your provider is willing to negotiate a payment plan or to accept a lower lump sum payment. This can also apply to a landlord or a student loan company or a credit card company. You'd be surprised how flexible creditors can be, especially when they know that you're facing a significant hardship like a serious medical condition. The motto we like to remember is that it can't hurt to try. If you speak with them and you're successful in getting on a payment plan or getting that lower lump sum payment, then you're in a better position financially. And if it was unsuccessful, then you're still in that same place that you were before. So it doesn't hurt to try. Now, because keeping track of all of this information is so important and can be so difficult, we have a medical bill tracker worksheet available on our website that you can download to help you keep track of your bills. Now, as we've discussed today, there are a number of options for health insurance that may be available to you. And it's helpful to know what all of those options are when you're making decisions about coverage. But picking the right plan is only the start. Once we have a plan, we also want to make sure that as consumers, we're making the most of those plans. And the way to do that is by using in-network providers wherever possible, asking for those prior authorizations if we need to, paying attention to our medical bills, and leveraging our out-of-pocket maximums. Now, when I say leveraging out-of-pocket maximums, what I mean by that is if someone has already met their out-of-pocket maximum for the year, you may want to think about if there's any other medical care that you've been needing but you've been putting off, because now may be a good time to do that care while you've already maxed out on your out-of-pocket maximum. Because at the start of each year, we start back at 0. And so if you've already met that out-of-pocket maximum, you may not have to pay for that care. So it may be a good time to receive certain care that you've been putting off, but knowing you needed to do. Now, obviously, that's not always possible, but when you have the choice and you're able to understand these systems, it can make a difference in how we go about using our health insurance. And then lastly, appealing claims can be incredibly important and valuable in making sure that you're using and utilizing your health insurance policy to the fullest extent. Now, that concludes the substantive portion of my presentation today, but I do want to note a few more things before we end. Now, with Triage Cancer, which is the parent organization to Triage Health, we have a monthly webinar series, and we have one coming up on January 30th on health insurance, and then another one in February on medical bills. So if you're interested, you are able to register for any of these webinars on triagecancer.org. We also record our webinars and post those past recordings to our website. So if there's a particular topic that you want to learn more about, you may be able to check and see if we have given a webinar on it in the past. Now, if you have additional questions about health insurance and you are trying to figure out where to go, we have a wide variety of resources on our website about the different types of plans, different options, and different ways to be using your health insurance. This includes quick guides, blog posts, animated videos, and past webinars. However, if you find that the resources we have on our website don't answer your particular question, I do want to mention our legal and financial navigation program. Now, through this program, you can fill out an intake form on our website and have a free one-on-one call with one of our staff attorneys. On this call, you'll be able to ask questions specific to your situation, and the staff attorney can help explain what options may be available to you and talk to you about what possible next steps are an option for you. And again, this program is available in both English and Spanish. Now, I will ask you to please join us again for our next session on Monday, the 29th at 12 p.m. Pacific, where we'll be talking about how to deal with work and a medical condition. I do also want to note that we will be showing a resource document that has some of these links to our different resources on it so that you are able to use those as well. And lastly, as a reminder, if you are a cancer patient, survivor, or caregiver and would like to participate in a survey study, you can scan this QR code, go to the web address on the page, or email Shufan for more information. Now, I thank you for your time and hope to see you again next week.